CVS is a large chapter, so we must know important drugs of CVS. In CVS, we have classification of antihypertensive drugs. In antihypertensive drugs, we have AC inhibitors like captopril, ramipril, enalapril. Then we have ARB, angiotensin receptor blockers like losartan, telmisartan, olmesartan. Then we have direct renin inhibitors like alaskrine. Then we have CCB, calcium channel blocker like diltiazem, verapamil, amlodipine, and nicardipine. Then we have diuretics, thiazide and related agents like hydrochlorothiazide and chlorothalidone. Then we have loop diuretics, furosemide and torsemide. Then we have potassium sparing diuretics like amiloride, spironolactone. Another group is sympatholytic agents, centrally acting, clonidine and alpha methyl dopa, beta adrenergic blocker like atenolol, metoprolol, propranolol, beta adrenergic blocker with additional alpha blocking activity like labetalol and carvedilol. Then we have alpha adrenergic blockers, again of two types, selective, non-selective. In selective we have parajosin and doxajosin. In non-selective we have phenoxybenzamine and phentolamine. Then we have vasodilators. In vasodilators, we have arterial dilators like hydralazine and minoxidil, diazoxide. Primary vasodilators like nitroglycerin, and there is another type which is both arterial and venodilators like sodium nitroprusside. Then we have anti-anginal drugs. Classification is nitrates, nitroglycerin, isoservide dinitrate, isoservide mononitrate, alpha adrenergic blockers like propranolol, metoprolol, atenolol. Then CCBs, calcium channel blockers like verapamil, nifedipine, amlodipine. Potassium channel opener like nicorandil. Then we have others like antiplatelet drugs, low dose aspirin, captopril, parasugrel, ivabradine, etc. Then we have drugs for PVD. PVD is what? Peripheral vascular disease. It is also called Borgers disease. It occurs mainly in smokers. Inflammation and blockage of blood vessels of extremities. It reduces blood flow. Pain in the legs and arms while walking using the limbs. Then classification of important drugs of PVD. Antiplatelet agents like aspirin, clopidogrel. Phosphoesterase 3 inhibitors like silostazole. Then rheological agents like pentoxifylline. Then alpha adrenergic agonists like isoxaprine. Then calcium channel blockers like lifidipine and felodipine. Then alpha blocker like parajosin, and others are xanthinol, nicotinate, vitamin E, which is an antioxidant, which works like that, and cyclandylate. Name is cyclandylate. Then drugs used in CCF, congestive cardiac failure. In congestive cardiac failure, we have diuretics, loop diuretics, furosemide, torsemide, aldosterone antagonist, spironolactone, and eplerenone. Thiazide diuretics like chlorothiazides, metolazone, hydrochlorothiazides. Then we have vasodilators, mixed arterial and venodilators, which reduces both preload and afterload. Arterial and venodilators, AC inhibitors, enalapril, ramipril, fosinopril. ARB, losartan, telmisartan, candesartan, direct renin inhibitors like alaskrine. Then sodium nitroprusside. Then we have venodilators like nitroglycerin, which reduces preload, have some effect on arterioles also, and isoservide dinitrate. Then we have arterial dilator, hydralazine, minoxidil, nicardipine. Then we have alpha adrenergic blockers like metoprolol, bisoprolol, carvedilol. Then we have inotropics like cardiac glycosides, digoxin, sympathomimetic amines, dopamine, dobutamine, phosphodiesterase 3 inhibitors, enamrenone and milrinone. Then vasopressin, receptor antagonist, tolvaptan and conivaptan. Here, tolvaptan and conivaptan. Then we have neprilysin inhibitors like sacubitril. Then we have brain natriuretic peptide BNP like nisiritide. Then we have classification of antiarrhythmic drugs. Class 1, sodium channel blockers, membrane stabilizing agents. Come to the point. Drugs that moderately depress phase 0 like phase 0 depolarization like quinidine, prosinamide, and disopyramide. Then drugs that have minimal effect on phase 0 depolarization like lignocaine and mexiletine. Then drugs that markedly depress phase 0 depolarization is flesinamide and propafenone. Then we have class 2 beta adrenergic blockers like propranolol and esmolol. Then we have drugs that prolong duration of action potential like amiodarone, sotalol, dornidarone. Then we have class 4 CCBs, verapamine and diltiazem, and other antiarrhythmic drugs like digoxin. Digoxin, where is this? Let me mark you first to know digoxin. Here, see digoxin, and then an ivabradine and atropine. Then we have hypolipidemic drugs. Classification HMG-CoA 3-hydroxy 3-methyl glutenyl coenzyme reductase inhibitors like statin, atorvastatin, paravastatin, lovastatin, simvastatin. Then we have another group fibric acid derivatives like zemfibrozil, fenofibrate, benzafibrate, clofevrate. Bile acid binding resins like cholestyramine, cholesterol, and cholisvalum. Then inhibitors of trigastrate production and lipolysis, nicotinic acid, dietary cholesterol absorption inhibitors, ezetimibe. Then we have colloidal solutions like human albumin, dextran. In dextran there is dextran 40 and dextran 70. Then we have hydroxymethyl starch and hetastarch. Then we have degraded gelatin polymers. Then we have polyvinyl pyrrolidine and crystalloids. In crystalloids also we have isotonic crystalloids, hypotonic crystalloids, balanced crystalloids, and hypertonic crystalloids. Uses of plasma expanders and their contradictions. These plasma expanders are also given there. Finish.